Horse back pain, part 2.
Right, so very quickly we'll look at the different ways nerve or neuropathic pain is exhibited in horses, and remembering the areas of autosensitivity I'm going to point out are not necessarily immediately related to the spine or the areas of neural anatomy. So remember, it's preferred pain. So firstly, this area here, the pole, we can get increased sensitivity here, which of course leads to horses that it's very difficult to put bridles on because the strap actually feels more like a weight than a strap. The same horse can be difficult to tie up because as soon as they get any pressure on that area of their anatomy, they will panic, and they will basically continue to panic until they break the tether. All right, coming down the neck, if the skin in this area here is hypersensitized, then trying to pull a horse's mane becomes a major deal. So from the horse's point of view, instead of feeling that, he feels, if I may, I won't do it, this poor horse, but obviously he's normal. So you get an exaggerated sense of stretch on those tissues, and therefore they don't tolerate it. In this area here, if horses that are difficult to give intravenous injections to, so what it quite often is, instead of feeling the prick of a small needle, it's more like you're putting a knife in there, hence that exaggerated response. Coming down the neck, similarly in this region here, if we have an increase in sensation, that can be very difficult to give intramuscular injections to. Right, now let's head down to the shoulder. And we hear a lot about shoulder problems, shoulder lameness, which are in fact very uncommon. You can get a lot of increased sensitivity in the muscles here, in the pectoral muscles, shoulder muscles, back here along the flank. Most of that referral of pain is derived from deep in the lower neck and the first part of the thoracic or chest vertebra. The way it presents, quite frankly, and you can do this yourself, if you stiffen your neck and try and lift your arms, it doesn't work. To lift your arms properly, you need to be able to bend your neck. Same with the horse. So a lot of shoulder lamenesses are actually lower neck lamenesses in a sense. With and combined with a shoulder lameness or a stiffness here, obviously we can have a stilted or shortened gait, and we can also have referral of pain to the feet, referred to as laminar chorial hyperesthesia. It simply means sensitive feet. And if you add sensitive feet to shoulder stiffness, or apparent shoulder stiffness, more to the point, neck stiffness, you get quite considerable alterations in gait. You'll get horses who don't tolerate hard ground, who don't like to jump. It's not that they're concerned about jumping, the up bit, it's the down bit. When they land, the sensation in their feet is like someone's hitting them with a hammer. So another area coming back, the girth, which is a sensitive area normally, can become hypersensitized as a result again of issues in here, and then you can have a horse who can be quite objectionable when you do up the girth, and that can suggest to you that in different behavioural manners that it's not particularly happy. Coming up, the region of the wither and this whole region here, and if I can quickly demonstrate in this also, this region here is a common referral place again from the first part of the thoracic and lower neck region, so that if one gets this sort of response, which we're getting here, that's just my fingers on the musculature, and we're getting an abnormal response. So what he's feeling is not just my fingers, it's more like he's feeling this. Okay, that technically is referred to as dorsal thoracic mechanical allodynia. It is not cold-backed, it is not ill-fitting saddle, and in the main it has nothing to do with these dorsal processes. It actually is derived from in here. So those are just some examples to do with the cervical neck and first thoracic areas. In these cases, if you're going to treat the problem itself, the primary problem, then you need to be treating them at a deep level. Another very important factor to take into account when you're dealing with altered sensitivity or increases in sensitivity is personality. And one of the expressions I hear which often makes me shudder is when I hear comment that a horse is just one of those touchy horses. Now, horses are like people. They respond differently. So some to the same stimulus will respond in a moderate sense, and some will become quite violent. The fact is the stimulus is still there. So if, for instance, with my dear assistant here, Kev, he could respond in this manner, or equally, he could respond in this manner. What we mustn't forget is I have poked him. Don't forget that. So it's not that silly, hyper-excitable horse. Get to the bottom of it. Thank you all.
Neuropathic pain often presents as an exaggerated response to a normal stimulus, such as touch or pressure, or to a change in temperature, or to a sudden environmental noise or movement. It can be